Hi there, welcome to the Healing Migraines Naturally podcast. I'm your host, Dr. Leslie Caesar, and I'm a licensed naturopathic physician, former chronic migraine sufferer, and I've dedicated my life to helping other women with chronic migraines rediscover a migraine-free life. So welcome to the podcast. I am recording this in June, and June is Migraine Awareness Month. So I've been doing sort of a special series of podcasts because I want to bring real awareness to chronic migraine sufferers, not the kind of awareness that the industry-sponsored Migraine Awareness Month with the purple ribbons and the hashtags and the migraine merch. Today, I want to cover a topic that comes up a lot, both in my practice with my clients and also in my free Facebook group, Healing Migraines Naturally with Leslie Caesar ND. And so this is actually one of the more common questions that people in the Facebook group post. So this doesn't just apply to June and Migraine Awareness Month. This does come up all year long. And this is how the questions typically come in. Does anyone else have fibromyalgia? I have chronic migraines and I'm wondering maybe I have fibromyalgia or, I have chronic migraines. Does anyone else here have fibromyalgia? I just got a diagnosis. So I wanted to talk about this because I've seen in my clinical experience that these two conditions sort of go hand in hand. And on the podcast, I have highlighted some common other conditions or symptom patterns that are very common amongst chronic migraine sufferers, and fibromyalgia is one of those. Here's what I want you to understand by the end of the podcast. If you have chronic migraines and you also have fibromyalgia, or you suspect that you might, you're just not doubly unlucky. It's not actually two separate problems or two separate conditions that just happen to be in your body at the same time. There's a reason why chronic migraines and fibromyalgia sort of travel together. And once you understand the reason behind that, I think it's going to make a ton of sense to you. Let's get into it. First, I want to talk about sort of the odyssey that both of these share. So I want to start with something that might surprise you. If you have chronic migraines, there's a fairly good chance that it took you a while to get that diagnosis, maybe a long time. You might have spent years being told that you had sinus infections, tension headaches, stress, or anxiety. Maybe you were given antibiotic after antibiotic for sinus infections that weren't really there. Maybe you left your doctor's office with your concerns minimized or with a prescription that didn't help or just with a shrug. I have a client right now who spent years being misdiagnosed with chronic sinus infections, multiple rounds of antibiotics, and they weren't infections, they were migraines. So the antibiotics did nothing for her head pain, and what they did do was tear up her digestive tract, which made her overall situation harder to address. So sometimes misdiagnosis doesn't just delay the right answer, it can actually cause you more problems. Fibromyalgia patients many times go through the same thing. The average time to a fibromyalgia diagnosis, so from sort of the first experience of the symptoms to a confirmed diagnosis, is somewhere between 2 and 5 years. Women are told that their lab work is normal, they're told that their pain is psychological, they're told that they're too anxious, deconditioned, depressed, drug seeking. They get passed from specialist to specialist, accumulating diagnoses that don't quite fit. Well, the real picture goes unnamed. Hi there, I want to jump in real quick and tell you about my client Beth. She was getting 15 to 20 migraines and headaches per month, and as you can imagine, this was impacting her work performance and her confidence. She also has 2 small children, and she was starting to feel like she was a horrible mom because she had nothing left for them at the end of the day. But she reached out and she booked a free consult call with me, and after I asked her about her migraines and her health history, I felt confident that I could help her. I help women uncover the root drivers of their migraines and follow a step-by-step plan to dramatically reduce the frequency by up to 90% without adding more medication or taking a bunch of supplements. So we built her personal migraine map, followed the plan, and now she will get 1 to 2 migraines per year, which she uses ibuprofen to treat if she needs to, versus up to 15 to 20 per month when we first started working together that weren't responding well to any medication. She just reached out to tell me that she got a promotion at work, she's on top of her career again, and has been able to come off all of her migraine medication. But most importantly, she's a confident mom again, and she's attending birthday parties at Jump Zone with her kids and saying yes instead of saying maybe later. I've worked with women like Beth from all over the United States who were told, this is the best we can do, but they were still willing to dig deeper. So if you're serious about changing your migraine story, go to drlesliecaesar.com/apply or tap the link in the show notes. And on our free consult, we'll map out why your migraines keep coming back and the first 3 steps you can take over the next 30 days. I do cap new client spots each month, so if the calendar is full, the doors are closed for now. But if you're done feeling helpless and ready to do the work to heal, pause this episode for 30 seconds and book that consult call now. So we have 2 different conditions, 2 completely different names, 2 different departments at the hospital, 2 different specialists, and the same exhausting, demoralizing road to get there. So what actually is fibromyalgia? So let's spend some time on what fibromyalgia is, because I think a lot of people are working with a loose version of the term. So in everyday usage, when people say fibromyalgia, they usually mean my body hurts and I'm exhausted all the time. Everything aches, muscles, joints, and no amount of sleep makes the fatigue go away. That's the general picture, and honestly, that's pretty accurate. The clinical diagnosis is more specific. So for decades, fibromyalgia was diagnosed using the 1990 American College of Rheumatology criteria. So this is the specialist that sort of takes care of the fibromyalgia condition. And so this diagnostic criteria required a physical examination of 18 specific tender points on the body. You had to have pain at 11 or more of those 18 points when the physician pressed on those points. You had to have pain in all 4 quadrants of the body. So upper left, upper right, lower left, lower right, plus your spine, and it had to have been present for at least 3 months. So the problem with this diagnostic criteria was that it required a rheumatologist to do the exam correctly. Like, these aren't just 18 random spots, they're specific spots. So most primary care physicians didn't do it. They didn't know how to do it, or they didn't bother. So a lot of people fell through the cracks. You really required a referral to a rheumatologist to get this exam done. And rheumatologists, they're notorious for you having to wait a long time to get an appointment. So in 2010, the criteria was revised. So the tender point exam was dropped entirely. The current criteria uses 2 things. So a widespread pain index, so how many of 19 specific body areas are painful, and a symptom severity score that assesses fatigue, unrefreshing sleep, and cognitive symptoms. So like brain fog, the inability to find words, walking into a room and having no idea why you went there. Symptoms need to have been present for at least 3 months and with no other condition that better explains the whole picture. So fibromyalgia is not just pain, it's widespread pain plus fatigue plus cognitive dysfunction plus sleep problems. So all together chronically at the same time. Bone deep fatigue, waking up exhausted no matter how many hours you slept, a body that aches everywhere, not one joint from one injury, not one muscle from one workout, but everywhere, and the kind of tired that isn't fixed by rest. So let's read that symptom list again. Fatigue, brain fog, widespread pain, hypersensitivity, sleep that doesn't restore you. Does any of this sound familiar to you, right? For most women with chronic migraines, right? Does this sound like a bad week before a migraine? Does it sound like the migraine hangover? Does it sound like last Tuesday? And so again, I'm going to tell you why this is not a coincidence in a few minutes. So here's the co-occurrence data, and this is where my jaw dropped, because I knew just from my clinical experience that this was common amongst migraine sufferers, but when I actually looked at the data, I couldn't believe it. So among migraine sufferers generally, 1 in 10 also has fibromyalgia. I mean, that alone is significant. That's what I was kind of expecting to see. But amongst chronic migraine sufferers, right, women who are experiencing 15 or more migraine days or head pain days per month, right? I mean, this is high impact migraine sufferers. That number rises to somewhere between 1 in 3 and 1 in 5. Up to 35% of people with chronic migraine also have fibromyalgia. That's just the people diagnosed, right? So in my clinical experience, I was thinking about this from the women that told me, yeah, I've been diagnosed with fibromyalgia, right? I knew that there was a connection here, right? There was a high co-occurrence. I wasn't even thinking about it from the perspective of just, I'm fatigued, I sleep and I don't wake up well, I can't sleep well in the first place, I have a ton of brain fog, my body hurts all the time, right? Like I frankly have become so accustomed to my clients feeling like that in general that I'm not even like thinking, oh, fibromyalgia diagnosis, right? I'm just thinking, yeah, this is what it feels like to have chronic migraines. But when you actually apply that to the official diagnostic criteria that's now in effect since 2010, right? This is where you get up to 85% of chronic migraine sufferers also have a fibromyalgia diagnosis or could be diagnosed with fibromyalgia. I mean, that's staggering, absolutely staggering. If you come at this from the other side, right? The first survey that they did was looking, asking chronic migraine sufferers. Now, why don't we ask the fibromyalgia folks, right? So sort of a different way of approaching this survey. So when you look at this from the fibromyalgia side, when you ask fibromyalgia patients how many of them also have migraines, that number runs between 45 and 80%. So these two conditions are not sort of occasionally bumping into each other. They're traveling together at very high rates. And the rate goes up as the migraine burden increases. So the more entrenched the migraines, the more likely fibromyalgia is also in the picture. So that progression from occasional migraines to chronic migraines plus fibromyalgia is a map of something getting worse. And I'm going to tell you what that something is. So here's something else that I've noticed in my clinical work that I also want to bring to the forefront here. So when I have a new client who has a diagnosis of fibromyalgia, of course, all of my clients have migraines, right? So that's universal. Everybody has a migraine diagnosis. But when I have clients with an official fibromyalgia diagnosis as well, there's almost always a difference in how they feel about the two conditions. So they have migraines, but they have some hope around their migraines, right? They found me, they reached out, they showed up, they believe on some level that something can be done for their migraines, otherwise they would have never reached out to me. But the fibromyalgia, they've many times written it off. They've accepted it as a permanent feature of their life. So they say things like, I know the migraines might get better, but the fibromyalgia, I've been told there's nothing that anyone can do about that, and I just have to live with it. So I understand why my clients land there because that's what conventional medicine is offering them. So migraines have an entire treatment industry. There are drugs developed specifically for migraines, right? Triptans, CGRP receptor antagonists, Nurtec, Ubrelvy, Aimovig, Botox, a whole class of preventative medications. We've got headache specialists. We've got headache clinics. Whatever you think of those treatments, and I know you've heard me talk about how I feel about them, least the message from conventional medicine is, we've got options, we're working on this, there's tons of things to try, right? We've got this. Now let's take a look at fibromyalgia. There are 4 FDA-approved drugs for fibromyalgia. 4. 2 of them are antidepressants, one of which is Cymbalta. Cymbalta is an antidepressant that is extremely difficult to wean off of, and many people experience side effects when they start Cymbalta. So Cymbalta, in my experience, is one of the least tolerated antidepressants on the market. We have Lyrica, which is an anticonvulsant, and then we have a muscle relaxant, cyclobenzaprine, right? Which many times migraine sufferers are given that as sort of a kicker for their abortives, right? None of these were developed for fibromyalgia. They were repurposed from other conditions, depression, nerve pain, muscle spasm. And their results in fibromyalgia patients are, let's say, modest at best. So your rheumatologist, your primary care doctor, they genuinely do not have much to offer you if you have fibromyalgia. And when a doctor doesn't have that much to offer, what do the patients hear? Even when the doctor doesn't say it out loud. They hear, "We got nothing for you. This is how it's going to be. Manage it, cope with it. There's no way out of this." And so patients internalize this. They stop expecting this to get better. They start organizing their lives around the pain and fatigue instead of around getting well. And that's not the truth. This is a reflection of the limits of conventional medicine and their prescription toolkit. And they're not the same thing. What I do when I help my clients restore their health is a totally different approach and toolkit than what your rheumatologist is offering you. Let's talk about what the research actually shows, because this is where I get fired up. So both migraine and fibromyalgia are associated with elevated levels of a neuropeptide called substance P. Substance P is a neurotransmitter that plays a major role in pain transmission. So I know a lot of you listening to the podcast, you're very well versed in these types of things because you've had to kind of take things into your own hands, right? And you've been doing a lot of research. So you've probably heard of substance P. So it amplifies pain signals. It's part of how your body says, okay, this is bad, pay attention. So in fibromyalgia patients, substance P in the cerebral spinal fluid, the fluid surrounding the brain and the spinal cord, is elevated to approximately 3 times the level found in so-called healthy controls. So this is not a small difference. That is a landmark finding, first published in 1994, and it has been replicated consistently since. So let's take a look at migraine sufferers. So plasma substance P is also significantly elevated in migraine sufferers. So studies comparing migraine patients to so-called healthy controls found substantially higher substance P levels. And this is true not just during an attack, but between attacks, during the headache-free period of time. When people feel relatively okay, that substance P is still running high. So we have the same neuropeptide elevated in both conditions. Now, I want you to check this out. Research has found that after ammonia exposure, substance P levels in serum, that's in your blood, elevated significantly. And research has shown that after organophosphate poisoning, so that's a class of poisonous chemicals that includes certain pesticides and nerve agents that trigger massive neuroinflammation, substance P is also elevated. So we have data showing that when the human body is exposed to known toxins, things that everyone agrees are poisons, substance P goes up. And we have data showing that substance P is elevated in fibromyalgia and in migraines. Conventional medicine doesn't put this together. What they say is that you have central nervous system sensitization. Your nervous system is more sensitive. You're wired to feel more pain. You have a migraine brain. That is a description. It's not a cause. Why is substance P elevated? Nobody in the conventional medical world is asking that question or answering the question, and I'm going to answer it. So I want to talk about the framing that is spreading rapidly in the migraine world right now, especially during Migraine Awareness Month, because it matters enormously what you believe about your migraines. The phrase is, you have a migraine brain. Your brain is more sensitive. You are neurologically different. Your threshold for a migraine is lower than other people's. For fibromyalgia, there is an equivalent. Your pain sensitivity is higher. Your nervous system is wired to feel more pain. Central sensitization, your brain's pain processing system, has become overly sensitive and stuck in a heightened state. This frame, it sounds scientific. When people say this, they sound compassionate. They sound like they're validating you. But what they're actually saying is This is just how you are. Your brain is different. Your nervous system is wired wrong. There's no root cause to find. The only thing we can do is manage it. And if you believe you have a migraine brain, a brain that is fundamentally, neurologically more sensitive, what are you working towards? You're managing, you're surviving, you're not getting out of this. But your brain is not more sensitive because it's broken, and I'm going to prove it. Pain is not a mistake. Pain is not your body misfiring. Pain is information, and it is one of the most important signals your body has. So I want you to think about when you put your hand on a hot stove, your skin is being injured. Okay, that injury generates pain. The pain activates a reflex instantaneously, right? Before you're even consciously aware that your hand is on that hot stove, your reflexes pull your hand away. It's the pain that saves you. Without it, you would keep your hand on that hot burner. And without that pain signal, you wouldn't just get a blister that heals in a day or two. You could lose your hand. I'm not being dramatic. This is a documented clinical reality. People with certain types of nerve damage from severe burns, from leprosy, from diabetic peripheral neuropathy, lose the ability to feel pain in affected areas. So diabetic patients with neuropathy in their feet, they can have a cut, they could get a little blister on a toe, their heel, the shoe is rubbing on the back of their ankle, tissue gets damaged, and they don't feel anything, and they keep walking on it, and they don't, oh, I need to put a Band-Aid on this, I need to wash this, right? I need to check this, I need to monitor this. They're not aware of anything because it doesn't hurt. The elevated glucose associated with the diabetes has damaged the nerve, so there's no pain being transmitted. If that wound gets infected, the infection spreads, and because they can't feel it, they don't respond. What ends up happening is amputation. They can lose a foot, sometimes the whole leg. This is a very real risk for diabetics that have lost that nerve signaling. So there are documented cases of people with nerve damage who have placed a hand on a hot surface and left it there, not because they chose to, but because the signal that should have told them to move was gone. The pain that should have been protecting them had been destroyed, and the consequence was catastrophic. Not a blister, major permanent damage. So the ability to feel pain, it's not a flaw, it's protection. And when it fails, people lose limbs. So when a neurologist tells you that your pain sensitivity is too high, that your body is generating too much of a pain signal, that you're overreacting to things in the environment, here's what that framing assumes. It assumes that the pain signal is wrong, right? It assumes that there's something defective in the alarm system. It assumes that there's no fire and that the fire alarm is misbehaving. And I completely disagree. There is a fire. Your body is responding correctly to a real problem. And the question we should be asking is not how do we turn down the alarm, but what is causing the fire? So here's what I believe is actually happening, and this is the core of my clinical framework. Your body is continuously producing what I call metabolic waste material. Other people might call these things toxins. Every single cell is, when it does its job, making hormones, making neurotransmitters, making enzymes, making cellular energy. Every single cell generates byproducts, metabolic waste, toxins. The cells produce it constantly around the clock as a normal part of functioning. On top of our own internal production, we are taking in toxins from the environment, the food supply, the water supply, the air supply. And I really want to be clear about this because in this day and age, people hear toxins and they immediately think man-made chemicals, pesticides, plastics, industrial pollution. And yes, those are very real and they do come into our body and they add to the load. Hi there. I want to jump in real quick and tell you about my client, Beth. She was getting 15 to 20 migraines and headaches per month. And as you can imagine, this was impacting her work performance and her confidence. She also has 2 small children, and she was starting to feel like she was a horrible mom because she had nothing left for them at the end of the day. But she reached out and she booked a free consult call with me, and after I asked her about her migraines and her health history, I felt confident that I could help her. I help women uncover the root drivers of their migraines and follow a step-by-step plan to dramatically reduce the frequency by up to 90% without adding more medication or taking a bunch of supplements. So we built her personal migraine map, followed the plan, and now she will get 1 to 2 migraines per year, which she uses ibuprofen to treat if she needs to, versus up to 15 to 20 per month when we first started working together that weren't responding well to any medication. She just reached out to tell me that she got a promotion at work, she's on top of her career again, and has been able to come off all of her migraine medication. But most importantly, she's a confident mom again, and she's attending birthday parties at Jump Zone with her kids and saying yes instead of saying maybe later. I've worked with women like Beth from all over the United States who were told, this is the best we can do, but they were still willing to dig deeper. So if you're serious about changing your migraine story, go to drlesliecaesar.com/apply or tap the link in the show notes, and on our free consult, we'll map out why your migraines keep coming back and the first 3 steps you can take over the next 30 days. I do cap new client spots each month, so if the calendar is full, the doors are closed for now. But if you're done feeling helpless and ready to do the work to heal, pause this episode for 30 seconds and book that consult call now. But here's what I also want you to think about. We have never lived in a pristine environment, okay? Not ever. Even before humans started manufacturing toxic chemicals, the natural world, it's full of poisons, okay? It's still full of poisons, even though we're not actually out in the natural world as much as we used to be. So plants produce toxins, bacteria produce toxins, mold produce toxins. Heavy metals occur naturally in the soil and in the water. Our own cells produce waste material that's toxic. So this is not new. This is the condition that we've always lived in. And this is why your body came equipped with the machinery to handle it. You have a liver, you have kidneys, you have a lymphatic system, you have lungs. Your body was built to detoxify because detoxification has always been necessary. So the question is never whether you're being exposed to toxins. You are always being exposed to toxins. The question is whether your body can clear them fast enough. So I like to picture like a bucket, like we have this little trash can, this little toxin bucket. Everything that needs to be cleared goes into that bucket. So we are continuously adding to that bucket via what we are making ourselves and what's coming into our body from the environment, whether it's a naturally occurring environmental toxin or a man-made toxin. But at the bottom of the bucket, there's a drain. Your liver is the primary drain. Okay, so I'm just going to reference the liver as we talk about this. So when the drain is working and the incoming load is not overwhelming it, the bucket never gets too full. Okay, stuff comes in, stuff drains out. It's never going to be totally empty because, like I say, we are continuously adding to this. But, if the bucket is just half full, we're going to feel okay. But here's where edit this. But here's where it gets critical, and this is something I don't hear anyone else talking about. In order for your liver to drain that bucket, it needs 2 things. It needs nutrients, raw materials to run its detoxification pathways, and this is what I call the first principle, or the first thing our body needs in order to restore itself back to health and maintain a state of health. We have to have the nutrients that our cells need at the cellular level. This is different than just eating a healthy diet. Okay, but that's what I call the first principle, getting the nutrients that your cells need to the cells. So your liver has to have particular nutrients to run the detoxification pathways to process these toxins, these waste materials. So if your digestive tract isn't functioning well, you're not absorbing what you eat, if the blood isn't delivering the nutrients to the liver efficiently, and this has more to do, this is more than just, is my heart pumping, okay? Your liver doesn't have the fuel it needs, the nutrients it needs to do its job. The second thing that it needs is cellular energy, cellular voltage, and that's within what I call the third principle, what I call our own resiliency and vitality. At the cellular level, our cellular energy is the voltage that runs things, and that's ties into what I call vitality. So if there's only 50% cellular energy in the cells of your liver is not going to run at 100%. It's going to run at 50%. So a liver running at 50% and doesn't have all of the nutrients that it needs is not going to keep up with the incoming load. The drain is going to get smaller and smaller and smaller. So what happens to people? They develop deficiencies or blockers within the first and the third principle. Their digestive function goes sideways, their vitality gets depleted, their liver slows down, and the bucket starts to fill up. Not because the world is uniquely so toxic right now, but because the drain has gotten sluggish. This is important because I see people out there waiting for the world to get cleaner before they can get well, waiting for the government to fix the food supply, ban certain chemicals, clean up the environment, and I understand the frustration. Listen, I want the environment to be cleaner too. I want certain chemicals banned. There's a legitimate fight. I'm not dismissing that, but do we just wait around and lay in a dark room in agony until the people in charge decide to act? I didn't wait around, and neither should you. Your path to health is restoring the function of the drain you already have inside you. You have a liver. Let's get it working. Now, when the drain is sluggish and the bucket starts to fill, your body sends signals, early signals, low-level signals. A common one, seasonal allergies. I've talked about this before on the podcast. Your body is recruiting the sinuses and the mucosal system, your immune system, to help with elimination when the liver is getting backed up. Skin breaking out. This is another common symptom. A runny nose after we eat. Water retention, brain fog, fatigue that shouldn't be there. These are toxicity symptoms, real ones. But they're the body saying that the bucket, it's getting full, okay? Instead of, a nice steady halfway mark, because like I say, that bucket is never going to be empty, it's inching up. It's inching up. As it starts to inch up, we start to develop these type of relatively minor symptoms. Migraines are a different category entirely, and I've said it before, and I'm going to keep saying it. Migraines are a hangover without the alcohol. When you're hungover, you're poisoned. Alcohol is the poison. Alcohol is a toxin. Your liver is overwhelmed processing it on a Saturday morning, and the byproducts of that process produce every symptom. The head pain, the sensitivity to light and the sound, and the complete inability to function, that is what it looks like when your body is dealing with a toxin load that it cannot clear fast enough. Now imagine you feel that way and you didn't drink a thing. That's a migraine. The bucket tipped over, not because of one drink on a Saturday night, but because the bucket has been too full for too long and the load finally exceeded what the body could contain, what that bucket could contain. And fibromyalgia, widespread pain, bone-deep fatigue, brain fog, hypersensitivity to everything. That is what it looks like when that same overload is not acute, it's chronic. The bucket isn't tipping over in one dramatic event, but it's been sitting near the top for so long that the body is in a continuous state of toxin overwhelm every day, all the time. So let me explain the mechanism, because this is where I want to push back on, this theory of central sensitization as an explanation. So toxin molecules injure cells, not in like one dramatic way, not like a surgery or a car accident injures you. They cause what I think of as like a million tiny cuts, constant low-level cellular damage from a load that the body is struggling to clear. And to repair those cuts, the body mounts an inflammatory response. Everybody's talking about inflammation in this day and age like it's a bad thing. Inflammation is not a malfunction. It is the body's repair process. So when you cut your finger, the area gets red and swollen and warm. That's inflammation doing its job, sending the immune system cells and repair resources to the site of the cut. Without that, you're not going to heal that cut. But when the cellular injury is constant, when the toxin load is continuous and the body never fully catches up, inflammation is also continuous. So a chronically inflamed body is a reactive body. An inflamed body generates more pain signals. An inflamed body becomes hypersensitive to stimuli. Now, listen to this. Research on fibromyalgia patients has found that they are hypersensitive, not just to pain, but to sound, to odors, to light. Does that sound familiar? If you have chronic migraines, you know exactly what that feels like. Many chronic migraine sufferers don't just experience that sensitivity during an attack. They live with light sensitivity and sound sensitivity and odor sensitivity as their baseline, even between attacks, every day. It's not just a migraine symptom, it's the state that their body is in. Fibromyalgia patients live with that hypersensitivity all the time. Chronic migraine sufferers often live with it all the time. It's the same picture. It's the same inflamed body. It's the same toxin load. Different label on the chart. And now connect it back to what I just told you about substance P. Substance P is elevated in fibromyalgia. Substance P is elevated in migraines. Substance P is elevated when people are exposed to known toxins, ammonia, organophosphates. The research has all of these pieces. No one has put them together this way. I'm putting them together. Elevated substance P is what it looks like when a body is being poisoned. Fibromyalgia and migraines show the same elevation. Your brain is not more sensitive. Your body is not wired to feel more pain. Your body is responding exactly the way a body responds when it's carrying a toxin load it cannot clear. Your substance P is elevated for the same reason it's elevated in a poisoning case, because that's what's happening. The label is different, the mechanism is the same. Now, I want to address something directly because I hear it all the time. It goes something like this. My brother-in-law eats like garbage and he never gets a migraine. I eat so carefully and I'm still getting them. It's not fair. I know it's not fair. I'm not going to tell you that it's fair, but I want you to have the full picture. Some people are predisposed to migraines and some people are not. Some people are predisposed to fibromyalgia and some people are not. We have genetic tendencies. We inherit particular vulnerabilities. And what I believe, what I've seen consistently in my clinical work, is that those tendencies don't express themselves until the body falls out of a state of health. So the predisposition that we inherit is the loaded gun, but it's not just the toxin overload that pulls the trigger, it's the deficiencies and blockers within all three principles working together that pulls the trigger. When the nutrients aren't getting to the cells, and then, your liver doesn't have the nutrients and the cellular energy or voltage or vitality it needs to drain the bucket, that's what pulls the trigger on the predisposition. So your brother-in-law eating whatever he wants, not getting migraines, he's not predisposed to migraines. His bucket may be just as full as yours, but his bucket doesn't express that overload as a migraine. It expresses it as something else. So here's what I want you to understand. Even though your brother-in-law doesn't get migraines, your brother-in-law is not okay. 3 in 4 American adults, 75%, have at least one chronic condition. Over half, 200 million Americans, have 2 or more chronic conditions. Among adults over 65, more than 90% have at least one chronic condition, and the numbers are rising. Among young adults, the prevalence of chronic conditions increased by 7 percentage points in just the last decade alone. So the toxin overload burden is not something that women carry more than men. Everyone is carrying it. The entire country is carrying it. People just express it differently based on what they're predisposed to. So men are predisposed to different conditions. Heart disease. Men develop it a full decade earlier than women on average. Diabetes. Men are significantly more likely to have prediabetes and go to develop type 2 diabetes. Gout. 4 times more common in men. Kidney stones. 3 times more common in men. Parkinson's disease, certain cancers. So your brother-in-law's bucket is full. His predisposition just gives him conditions that can simmer quietly for years before they announce themselves. I hate to say it, but right up until they announce themselves as a heart attack or a stroke or a gout attack that puts them on the couch, or a diabetes diagnosis at 52. So the migraine sufferer, we can't ignore the overload. The fibromyalgia patient can't ignore it. The brother-in-law, he can ignore it right up until the moment he can't. Migraines are obvious. They take you down. You're in bed. You can't function. You can't fake it. The person with migraines knows something is wrong because the migraine is not going to let them pretend. The person with migraines, right? We know something's wrong because the migraine is not going to let us pretend otherwise. Other people, they can power through. They can attribute the fatigue, maybe, I'm getting older, the gut problems to stress, or, everybody has heartburn, don't they? The brain fog, I haven't been sleeping well. But they're not fine. They're faking it. And the migraines, as awful as they are, at least they give us the clarity that something needs to change. Now, why are women more prone to these particular conditions? Migraines, fibromyalgia, autoimmune diseases, conditions that are loud, undeniable, and impossible to push through. I have a hypothesis about this, and I want to be clear that this is my original thinking. This is not, settled science, but I think it's worth just mentioning here. So from an evolutionary standpoint, female reproductive capacity is the rate-limiting factor for population survival. A woman can have one baby every 9 months. That's the bottleneck. And this is established evolutionary biology. It's called Bateman's principle. The implication is that female health has always been more critical to the survival of the species than male health, just from a pure population mathematics standpoint. So this is my hypothesis. Women's bodies may have evolved to generate louder, more undeniable health signals precisely because the cost of a woman ignoring her health is higher. The migraine won't let you ignore it. The fibromyalgia won't let you ignore it. Maybe that's not a design flaw. Maybe that's a feature. Maybe the signal volume is turned up in women by design, because historically, a woman who's ignoring her body's warning signals paid a higher price than a man who ignored his, and then society ultimately pays a higher price. So that's my thinking. It's a theory, it's a hypothesis, something I wonder about, take it for what it's worth, but I find that pretty compelling. So if you have both of these diagnoses, if you've been told that you have fibromyalgia on top of migraines, I know what that felt like. You probably left that appointment feeling like now it's even worse. Now I've got 2 incurable conditions instead of 1. And I want to reframe that. Having both does not mean that you have 2 separate problems to solve. It means you have one problem, a sustained significant toxin overload compounded by deficiencies within the first and the third principle as well, expressing in 2 different places simultaneously. The migraine is your brain and your nervous system screaming about it. The fibromyalgia is your entire body screaming about the same thing. So it's one problem, 2 different expressions, same root, same solution. So here's what I see in my practice every week. When clients come to me with both diagnoses, they are almost always resigned about the fibromyalgia. They've accepted it. They say, I know you might be able to help me with my migraines, but the fibro, I know I'm going to have to live with that. Here's what I tell them. When we address the root, both get better. Not one, both, because they're not 2 different problems. They are one situation the body's expressing in 2 different ways. So when we work to drain that bucket, to restore the liver's capacity to process and clear the toxin load, to rebuild the nutritional foundation so the first principle is working, to restore cellular energy and vitality so that the third principle is working, the migraines improve and the fibromyalgia improves. The widespread pain decreases, the fatigue lifts, the brain fog clears. This is not, just sort of an accident. This is exactly what you would expect to see when the root of both conditions is the same. You didn't get 2 diseases. You got one situation your body expressed in 2 ways. So the path forward, it's one path. Your body is not broken. Your brain is not wired wrong. Your nervous system is not permanently sensitized. What you have is a bucket that's been too full for too long, and buckets can be drained. So if you're living with chronic migraines, with or without fibromyalgia, and you're ready to understand what's actually driving it and what you can do about it, I'd love to talk. I offer a free consultation call. The link is in the description, and we'll talk about your migraines, any other health conditions you have, and we'll put together a game plan to get you feeling better. It's going to be, no joke, the best 30 minutes you've spent on your health in a long time. So thanks so much for being here, and I will talk to you soon.